pathology. I'm sure we have medical personnel among us, right? So we deal with tissue, we study tissue, and I handle a private histopathology laboratory. Honestly, the kind of cases of cancer is on the increase right now. I can't compare the result that I've gotten last year in November, December. The one for January, February, honestly, is scary. Just like the way typhoid, malaria, that is what we're seeing in that lab. I have more interesting cases compared to even Jute. Because anytime that they need that result urgently, they come to a private lab because the next day or in 2 days you can be able to get that result. So I have very interesting cases in me. And like in January, I received about 145 samples. But out of that number, or these numbers, about 85 to 90, they are cancers. And it across all ages. But yara, manya ne, matasa din is affected. And most of these samples, breast samples, maybe lungs from the breast, prostate samples, cervical samples. Yes. These are the common ones. It's so rampant. They will remove a lumps. Before you know it, when you check it, it's already cancer. When you ask that lady, how long have you stayed with it? She told you maybe just 2 months, 3 months. But before you know it is cancer already. For those that are not lucky, right? So since this thing is in the increase, what do we do? How do we help ourselves? How do we educate our women, our men when you reach 40, come out and do your PSA? Or a young lady at home, our daughters at home, how do you check for that law? How do we help them, right? So whenever they come for those their results, those patients will they don't want to just collect the result and go. They would like to ask you, hope the result is okay, or what is the result? And at that moment, you have to be prepared for counseling. Yes. Certainly. You can't just leave them like that. For those that will be insisting, because we normally refer them to their doctors. Go and meet your doctor. But that person will say, no, please, let me know. So you have to counsel them before you declare to them this is cancer. But there is hope today for cancer. There is hope today for diabetes, for BP, any condition that there is hope today, right? On what I'm going to discuss right now. So I always discuss about the health optimization through nutrition, supplementation, and lifestyle changes. Now there was a research that was carried out between 2020 and 2022. I hope we are seeing the from there, right? So the life expectancy for men and women is between these ages. I think you can see it from there. Right? You can see the ages. Normally, when women reach this age, that's between 56 to 57 plus, and then men between 54 to 55 plus, at this age, based on statistics, they come up with one sickness or the other. Be it typhoid, be it malaria, be it BP, diabetes, cancer, and the rest, right? Not that we are not getting them below this age or above this age, but averagely, statistically, based on this, right? So now, what is the major cause of death in Nigeria? Based on that research, we discovered that sickness is number one. Is the number one cause of death in Nigeria. And we can see like about 26%, followed by poverty, which is 24%. Now, when you add up these two together, we have like 50%, right? So we know that these two together goes hand in hand, goes together, right? Yes. Now, sickness, why sickness? In our health facilities, do we have the right equipment that we can handle those patients? Do we have them? And when you look at it, there's no job satisfaction. A lot of all these our health workers, they're doing this, what do you call it?
Japa syndrome.
Yes. You know how to do the work, you know how to handle that equipment, but it's not there to handle that patient. And you may end up losing that patient. So they are tired. There's no job satisfaction. And what they are being paid at the end of the day is not something much. Now, when you look at poverty, maybe somebody might end up losing his patient because of just 20,000 to carry out a surgery or for a delivery or something like that. They don't have the money. So when we look at the rest, the percentage is not really much. But if we can take care of these two, that is up to 50%. Sickness is 26 and poverty 24. When you add them together, they are 50. Now, if we can take care of this, Do you think we can reduce the rate of death in Nigeria? We can definitely do that, right? Okay, so let me go on. Now, we all have an idea about free radicals, all right? Can somebody help us what free radicals are? At least let it not be only me discussing. Can somebody help us? What free radicals are? Free radicals. What are free radicals? Sorry. So what are free radicals? What are free radicals? Somebody should help us. Yes, sir.
These are chemicals from food substances that remain in our body and are harmful to us.
All right. Then apart from that, thank you, sir. Apart from that, do you have any other additional? All right. So they are like they enter our body to snatch energy within our body. They are more of microorganisms that enter our body, snatch energy within ourselves, destroying ourselves, making us to be sick, contributing, triggering to all these conditions that we're having, right? So how did they enter our body or how did they get into our body? Poor diet. We all know what poor diet is, right? When you don't take the enough protein and other things, right? Vegetables together. And when you look at it, most of our food is what? Carbohydrate. We eat more of carbohydrate. You will find out that in a day, somebody will be taking maybe bread with just maybe sometimes actually one little go, when buy some madara, and in the afternoon maybe another thing, or something like that. Then in the night, these two and some any crayfish or any fish inside. Okay, so all those things. Then apart from that, there's another one, alcohol. No matter how small quantity you are taking it, you are introducing free radicals into your system. Right? Okay, if you are not free, maybe or if you can adjust to right? So alcohol is another one. Alright? No matter how small that alcohol you are taking it, how small it is, you introduce free radicals into your system, right? And in this type of condition, when the cases you getting with alcohol, you have liver cirrhosis and what again? So many, soon and it can even lead to cancer, right? Then another one is what? Is cigarette. You must say, I don't even smoke. How can free radicals enter my body? As long as you are in an environment where they smoke, you being a passive smoker is even worse. You introduce more free radicals into your system, being a passive smoker, right? And in this type of cases, we see what? Like cancer of the lungs, they can have even in the throat, right? Cancer of the throat, of the lungs, and the rest, right? Then another one is stress. Stress introduces free radicals into our body. Stress introduces free radicals into our system. How? We have this cortisol hormone. That's a stress hormone. As long as you are stressing yourself, that hormone releases more free radicals into your body. Especially mu mata aikin gida yana karewa. Yi mun fara aiki ba mu san mu bari ba. Ba mu san mu daina ba mu huta. Please, if you have that kind of wife at home, and tell her to be resting. Aikin gida baya karewa. Mu ji da yara ne ko mu ji da wani. You understand? So we dinga rage so da mu huta ba, and then this stress of it, most of us we don't rest, go to work, go to here, looking for money here and there, and ba hutu. And rana mun fara ciwo fa. Who will do the housework, right? So all this is right. So apart from that, there is radiation. Radiation from what? Our mobile phones, our laptops, our electronics within the house and in the office, they emit radiations. We don't see all this radiation with our naked eye, right? And this radiation also penetrates and destroys our cells. Now it produces more free radicals into our body. Akwai some of us that will use our phones, maybe under the pillow, right? Some in the pocket, or muna yawo da shi. It introduces free radicals into our system, right? So, and then apart from that, and we know that radiation also causes cancer, right? Then apart from that, we have what? Infections. Infections also introduce free radicals into our system, right? Then what again? We have drugs. This is another danger. I'm not talking about drug addicts. I'm talking on drugs generally. Drugs are what? They are chemicals, right? As long as those drugs are chemicals, they introduce more free radicals into our system. We all know that paracetamol, every drug has its own side effect. And that is why when you go to a pharmacy, you bought maybe a drug, when you check, there are pamphlets inside. And they will indicate the side effect of that particular drug. When you observe this side effect, please discontinue the drugs. What? Meet what? Your doctor. Yes, at the end of the day, right? So drugs introduce free radicals into our system. When you look at it, let me give you an example with this drugs for uh, patient with chronic diabetes. The drugs that they are using or the drugs that they are taking, it affects their kidney. And that is why whenever they go for a checkup, the doctor will always ask them, go to the lab, let them take your blood and do urea and creatinine to check the level of those within the system, right? So it affects their kidney, destroying their kidney at the same time. And if they don't take those drugs, what will happen? The sugar will what?
Rise.
Will rise. It will shoot up, right? And it can kill. And as they are taking the drugs, it's destroying their kidney. So wanaweza mikina, right? Wanaweza mikina. Eh? Yes. Now, apart from that, I don't know if you have ever seen cancer patient. A cancer patient. And those that are undergoing chemo. Please, you are switching. Yeah, appearance is switching. Eh? Yeah, chireko. Remember that chemotherapy that they are doing to them is chemical that they are injecting into their body. And these chemicals, I said, they introduce what? Free radicals into our system. Now, as they are doing that chemo to them, there's this hair loss, right? Sometimes with these rashes within their mouth, they don't even feel the taste of what they are eating. Do you understand me? Then apart from that, it depends on the duration of the chemo, the type of chemo. It can destroy their liver or kidney or brain or heart, any place in their body. You understand? And whenever they are doing that chemo to them, it reduces their blood level. So whenever they come for a clinic, maybe after the first dose of their chemo, they will always ask them to go to the lab and check your PCB. Let's see the level of your blood, right? It affects their immune system. It affects their blood, right? So apart from that, wonder chemo, and that chemo is somehow painful. It's very, very painful to them, right? So it's destroying their cells. Remember, they have a lot of free radicals within their system. Now you're adding chemo to it, introducing more free radicals into them, right? But when you perform a clean patient activity, maybe you have gone around and you want to ask it by some, so you've such a required to another place. Now that patient, but by the time admission, right? Maybe day 1, day 2, what will you be expecting within the hospital environment? To be getting better, ma? But sometimes what happens? And at the end of the day, ma, lose the patient. Already there's enough free radicals within the patient system. And what we don't do magic. When you bring that patient, we look at the right antibiotics or the right drugs that we can use to treat that patient. Now, on the process, we're introducing what? More free radicals into that patient system. All right? So that is it. Now, another one is what? Is pollution. Pollution from where? From our environment. We all introduce free radicals into our system, right? Sometimes maybe somebody will like, before you know it, it's all over inside your body, it's all over inside your house, right? So free radicals lead to what? Oxidative stress, affecting the brain. I think the writing is so small that we cannot see from here. Can even cause brain cancer and some other conditions. Like the heart, it can also affect the heart and so cause other conditions, the kidney, the skin. Like that of the skin, it can cause what? For the heart, it can cause heart attack, stroke, high blood pressure. It can trigger, it can contribute to this condition. Then the kidney, we also have all these chronic kidney diseases, renal nephritis. The skin will have wrinkles, acne, eczema, and the rest. Also, it can cause cancer of the skin. We have the multi-organ, it can also affect, causes diabetes and some other conditions. When we come to the joint, we have rheumatoid arthritis and some other conditions. Then the immune system, it's cause chronic inflammations, HIV, it contributes to the condition, sorry, and can also cause cancer. Then when you come to the blood vessels, you can see hypertension, atherosclerosis, and the rest. Then when it comes to the lungs, it can also cause other conditions in the lungs and even cancer can cause cancer. Then when it comes to the eyes, you can see other conditions, and then it also contributes to cataracts. So this is how our body look like, right? And we said these free radicals targets or snatch energy within our cells. So the last picture looking brown is how our cells look like under the microscope. So free radicals targets these individual cells, indirectly destroying the tissue, destroying the organs, destroying the system, and then it shortens the body. In ya kawo this stage me ya faru kenan mutum ya riga ya mutu, free radicals they have finished their work, right? So what is the solution to these free radicals? We know what antioxidants are, right? What are antioxidants? What are antioxidants? Ya zama kamar ni kadai nake magana. What are antioxidants? Can we contribute? Ko? Sana? Na dauka ko ne ko suna zama.
Su dau belin mu mana.
Likita ka dan
Well, antioxidants are chemical agents that mop up free radicals in the human system.
Thank you, sir.
Yes.
Yes. All right, that all?
That's all.
So thank you very much, sir. Please, we have a mission. Thank God, doctor. Thank you.
So the word
yes.
Antioxidants,
okay.
that oxidize.
Yes.
So you're antagonizing.
Yes, that's good, right?
There's a pharmacist, okay.
Good. Good. Right? So that's good, right? So where do we get these antioxidants? From our vegetables, from our fruits, right? Right? They take care, they mop up the free radicals. So what are antioxidants? They are specific nutrients in our food that prevent or slow the oxidative damage of the free radicals to our cells, right? Secondly, they act as free radical scavengers. They are heroes, right? Then another one, they prevent and repair the free radicals damage. Yes, that's what antioxidants are doing. Now, according to Dr. Richard, he said the amount of antioxidants in your body is directly proportional to what? To how long you will live. Munganiba? Yes. So these are the simple vegetables and fruit. And I thank God Plateau State, my local last. Maybe the venue is in terms of fruit. Yes, in terms of fruit and vegetable, maybe the venue is Plateau State, right? So we can see some of them. They help to destroy these free radicals within our system, right? Now, according to World Health Organization, they said we need to eat at least 5 kinds of fruit and vegetables every day. That if we're eating all these things, we will not be sick. That will not be sick. Eating 5 kinds of fruit and vegetables, all these free radicals will not be there. Please, this thing or what they said, it was during our great grandparent. Now, if you like, eat 100 times. If you will be sick, you'll be sick. Go back about the please put up right? Before our great grandparents they are using what in their farms? Animal dung, right? Animal dungs in their farms, right? Yau mun yi amfani da shi ba za a ce ka kasa ma maka dariya. Ka kasa sayan fertilizer ko ba haka ba, right? So they are using all those things in their farms, but nowadays we are using what? Fertilizers, chemicals. We are using it at home. All this in at home, not all right. You must buy some in the market. But when you look at it, even the ones that you don't even buy have at home, if you want to buy it, they apply what to it. Chemicals. They apply chemicals to it.
Preservatives.
Or preservatives on them. Some of them they like.
Or herbicide.
Yes, they will go and get all these things from the farm unripe, right? Overnight, the carbide wrappings it and then it preserves them looking fresh. We know all this challenge. Yeah. We have them around that railway crossing, looking attractive, looking good, all the plantains, apples, everything. I was discussing with one woman last year in December at Rentia. So I was discussing with this with her. She said, because my husband is in Lagos, working in Lagos, and I went with the children for Christmas holiday, Christmas break. That we went out that day or running Christmas Eve. That one of their boys, bought 3 apples. And thank God it was the only one that ate those apples. But that night, ba su kwana gida ba da ita da mai gidan. Yaro ya fara zawo yana ta amai. They rushed him to the hospital. And at the end of the day, they told them it's food poison. So what happened? She now remembered that, yeah, abincin da muka ci kowa shi kowa ci a gidan. She remembered that he bought 3 apples and he was the only one that ate it. So it was from there. You understand? So they inject them looking good, looking attractive. And when you eat, it's something else, right? So apart from that, you have 7 things to optimize your health, right? From here, I think the listing is it's not really clear. Now, eat healthy, right? We should minimize what? Carbohydrate and eat maximize more of protein, right? Then apart from that, routine medical checkup, like after 6 months, go back about doctor, we should go for a medical checkup. Please, Mutana needs to. How many? 4 people there, please. Mutaba also. Yes. So some people will say, I want my son, Jack, I don't want to It's better as you know, right? And you take care of it on time, right? If you don't it's better, right? So let me give you an example with cancer of the cervix. This one that will ask women to come for pap smear always, right? You come just once in a year. If there is any issue, we'll ask you to come back after 3 months or after 6 months. Let's see. After treatment, let's see whether it has reverted back or is progressing. Is it not better? It's better. There is a cancer and a farmer. Yes, what about a patient? I come sample. They brought a sample. Was it on Friday to me? They are on Thursday that they need the result on Friday. Already, any minor surgeries in Abuja. She's on admission right now injured. Your guy has a cancer. Cancer of the cervix. Your guy has a cancer, and they told her there is nothing that they can do. Amanda Tana screen it in for. It would have been better, they would have discovered it on time, right? So that is it. Just go for your routine checkup like men, PSA, to check your protein-specific antigen. Go back about doctor, especially in Sunkai around 40 years, right? And then about you go and be checking it. Because those samples that I have, honestly, breast, prostate, cervical, these 3, too much. Right? Then apart from that, exercise regularly, right? Then we have reduced alcohol and cigarette, right? Tobacco smoking, right? Then stay hydrated, that we should take about 3 to 6 liters of water every day. Go. Then another one, sleep well. Go. 3 to 6 liters of water. Yes. Then sleep well, at least 8 to 6 hours. Then if you have supplement to take, you can do that, right? So I'm going to discuss something. I'm just rounding up now. I'm going to discuss something today. This is where I want us to concentrate. Have we heard of this ultra-molecular hydrogen water? Have we heard of it? Right? Now, since they have contaminated all these our fruits and vegetables, and they are the ones that help us to deal with these free radicals, what do we do? There's what we call the ultra-HO molecular hydrogen water. Taking just 1.5 daily, 1.5 liters daily of this water is like you taking 79 bananas. I wonder how much 79 bananas they gama the share now. Is it possible? It's like you eating 38 carrots. Balance is right? Yes, 38 carrots. They were from morning till evening. Doctor said you go. Abi, you can apples. 516 apples. That's only day one. The last one, 863 coenzymes. Just 1.5 liters. No wonder. In Kafaraba masu BP. The BP normalize. Because free radicals triggers their condition. Free radicals contribute to their condition. No wonder when you start giving it to people with diabetes, the sugar level normalize to the barest minimum. All right. Then apart from that, cancer patient. Right now, I have 5 cancer patients. Honestly, they are on this. They are on this water. What is happening? I will always tell them, don't disobey the doctors. Go and do your chemo. Because this thing will take care of this, will take care of the side effect of chemo. This hair removal, coloration of their nails, vomiting, purging, dizziness and other things. It takes care of it. Because as like I said, those chemo drugs that they're giving them, they're introducing more free radicals. And this thing deal with the free radicals. I have 5 patients right now, they're on this. 4 of them agreed to do the chemo, and as they are doing the chemo, one of them called me that they are doing the chemo for me. I said they are not doing anything. Because she has done chemo before in 2024, right? Come on, Bazate. All this hair removal, coloration of these her nails, and everything happens to her. But the answer 2025 around September to start another round of chemo for having cancer of the breast. She started taking this water before they started the chemo. And as they're doing the chemo, nothing happened. Then another one, she even refused to do the chemo. That she wants to dwell on this water. Even 2 weeks ago, I spoke with her. She's doing amazing. So what are the function of this bottle? All right, let me show us the bottle. It's here. This is the bottle, the ultra molecular hydrogen bottle. When you purchase this bottle, you only charge it for about 5 to 6 hours. You can use it for about 3 to 4 days without even charging it. What you do, you just add your water and generate the hydrogen. All right, you add your water and then you turn it. It has like 2 timing, 5 minutes and 15 minutes. For 5 minutes, it has lesser concentration of hydrogen. For 15 minutes, it has higher concentration of hydrogen. So normally, when you start with 5 minutes. Let your system get used to what? It's something that you're introducing, just like a baby now in fire. You don't start giving that baby pap. It's breast milk that it can digest, right? So you start with 5 minutes. Maybe like after like 3 or 4 days, then you can continue with your 15 minutes, right? So if you don't want to be moving around with this bottle, because it's big, there's another attachment, a cup, that you can join it with, and then you use your water. You use your bottle water, right? That means one can go out with this. So one put in here and you can press it. And then very yes, everything at once. Right?
5 minutes.
Very much.
Alright, so what are the functions? It reduces fatigue and boosts vitality. Sorry, let me just round up. It reduces fatigue and boosts vitality. Alright, all this tiredness and everything. When you start taking this water, you feel it again. Right? The remedy for allergies. Allergies maybe ko mun dan je kawai mun dan sha ruwan su dinnan ko abincin su wani dan rashes wani dan kai it will help us, right? Then another one, it promotes both heart and brain health, right? Then another one, cancer prevention and treatment. It destroys the free radicals, right? Normalize blood sugar, okay, for those with diabetes, right? Anti-inflammation, and then it prevents and reverses degenerative diseases. Right? Doctor is here. Doctor, can I example of degenerative diseases so that's Benji?
Sorry?
Degenerative diseases.
Okay, like all this arthritis.
Arthritis, yes.
All different forms of arthritis.
Yes, right? Yes, so it takes care of it. There is anti-aging. When you start taking this water, you look young. You look young. You look good.
You look young, but you're old.
You are old, but you look old. Yes. No, I will give you an example. Let me just finish. Then slimming, it burns the excess fat. For those that are fat, it burns the excess fat. Then it improves memory and cognitive function. I go and then kind of discussion this week. Just to look at. But we want to magana. Yeah, yes. So let me give you an example. Let me give you my own testimony with my dad. My dad, retired Reverend in Equal. He's in Kasana. He's about 103 years old. My mom, 90-something years old. Last year around January, Najigida, said Baba Makanishi. Baba is having a heart issue, having BP, ulcer, pains within his body. So many things on Baba. And they did this prostate surgery for Baba. Even though it has not reached cancer, but since that surgery, everything about Baba ya canza. Jikin Baba komi ya canza. So January, around that January, they asked me to give him his medication in the morning. Remember all the conditions that I told you? That means tablets and the capsules as you hear about, I gave him. And I know that these drugs that they are giving Baba is contributing to his condition. We're introducing more free radicals into Baba's system. So around August last year, I called my sister and I said, "Ya Baba yake." She said, "Baba is waiting to go. Baba yagaji. All these drugs are not even working on his body. Yagaji na so mutu. Mutuwan ya ki daukan shi dan yana counting wanda sun mutu su sun ji dadi. Mutuwan ya dauke su shi ne dauke shi. So that day that she told me this, honestly, na kasa bacci da daddare. I now remember that if I can get this for Baba, this thing will help him. I purchased this bottle and I sent to Baba in Katsina. Baba has been on wheelchair for over 5 years, and that's surgery over 15 years. Baba, you have to like carry him on the bed, put him on the wheelchair, bring him to Palo, in the evening, and in the night, you have to go around maybe 2-3 times to like check him and turn him so that he will not be tired to one side. And for Baba, they now notice that Baba can lift his hand very well. He can lift his leg very well. Within that week, the second week, Angie and Juya Baba, they discovered that this was not the position of Mukaji Baba here. Abin ya basu mamaki, they called me, "What is in this water?" I said, "Continue giving him." Baba an zo an samu, Baba now yanda ake magana, Baba zai iya tashi ya zauna kan gado. The only thing that he has not been walking, so they have to like therapy and everything to like help him how to like start walking. Okay? Now, honestly, to be frank with you, with his BP, I'm checking BP. They now notice that whenever they check his BP, it's always over. I said discontinue that BP drugs because this thing is taking care of it. It normalizes the BP. And then apart from normalizing the BP, after like almost a month, my sister called me and said, "Amina, there's no something on Baba again." I said, "What is it again?" They said the wrinkles on Baba's body, they are clearing. If you see my data, Anche Mukuyaka 103 is not a this bottle is working. Yes, yeah, the condition that she. Baba, no, it has not fixed up. Okay. It's telling you it's ready. Okay. So that you can just use the water. It isn't test. So that we'll do more, right? So let me say the principle random. Let me say the principle behind this so that we'll ask some questions. Okay. So what is the principle behind this? There are two things that enters the cell, right? We have water and what? And gas. And this hydrogen gas is the most tiniest gas. It's very, very small gas. They are very, very tiny. What we are seeing here is not Diana Taposa, it's not boiling. It's generating hydrogen gas. The bubbles that we are seeing inside the container. Right? So when you take this water, this hydrogen gas or these hydrogen molecules enters within the cell, penetrate the cell membrane, enters inside the nucleus, inside the nucleolus, inside the mitochondria, which is the powerhouse of the cell, destroy every bit of free radicals within those cells. But in case of chemo, what chemo is doing normally before they will start that chemo, the oncologist will sit down with that patient relation and the patient. This simple, 50-50 is destroying both the cancer cells and the normal cells. Are you getting me? But in this, what this hydrogen molecule is doing is destroying those free radicals and then making the normal cells to multiply very fast. Actually, no wonder cancer patients responding. ko ya condition din ya kai kun fara ba su wannan za ku ga sun fara responding. Patient din ma da kanshi zai ga maka me yake ji a cikin jikin shi. Be it diabetic patient or BP patient, any patient, it destroys the free radicals, right? So, like in case of cancer, it enters and destroys those free radicals within the cancer cells. And cancer cells, when we look at them when we view them under the microscope, in Sunana, it's like they are announcing themselves under the microscope. You will see them different from normal cells. So this water multiply the normal cells and destroy those free radicals within the cancer cells. All right? And then, so I think let's continue with the generation, and then maybe if you have some questions. But there's one, okay, there's one disadvantage about this bottle. Would we like to? Yeah. A lot of advantages, but there's one thing. Ina iya kisha. Mami ki taimake mu.
Amma da akwai cups din samu.
Oh, generated.
So ki juya kan abu sai ki juya.
Not discovering that bottle, the water you have there, kai din zai fit na cikin wannan.
This you can't use one water bottle.
No, but some
The bag is bigger. But this one is wider. This one is smaller.
it's like
yes, you can.
the water so you bring in. Bakin zai shiga cikin wannan. Yeah.
So maybe disadvantage. Akwai da zai taimake mu. Fada? It's the price.
Okay, price.
Expensive.
It's expensive. But when you look at it, it's 1.3 million.
About the bottle, there's nothing.
You've not finished.
It's 1.3 million. Okay, let me say it's 1.3 million.
The bottle.
Yes. This package like this. There's Type-C charger. You have manual, and it's also you can use it for asthmatic patient. As you are generating it, where is it? Okay. As you are generating it, you clip this. As you are generating, there's a tube with something like a face mask. That patient will be inhaling it, and it will be like clearing the chest. For asthmatic patient, they should inhale. The patient will be inhaling the hydrogen gas. Yes. So the bottle is 1.3. The bottle is 1.3. But when you have this bottle, free radicals, they are always the ones triggering our condition, contributing to this condition. And if you are dealing with these free radicals, you can go to our activity, maybe kunje check up me. For the family, kunje check up me if you have this bottle. And then apart from that, the whole family can be taking this bottle, water. When you are thirsty, not that you must take 1.5 liter, you can take more than that in a day. Let this be your water. And if I should not say bottle, then there's other 1.3. If I'm to charge it, I will use my normal stabilizer to control the current. Go back about, and then you don't use another charger for it. There's a specific charger for it. And then don't use fast chargers. We have manual here. Fast chargers like what? Like our power bank. We should not use our power bank to charge it, right? Then apart from that, anything that you maintain, is maintenance. You do maintenance because on lafiya. But when maintenance, it will spoil now, right? Zai sha duka ba. Yes, zai sha duka. So, there's something I want to say, the disadvantage is the money, 1.3. But you cannot compare it with a patient that patient under dialysis. How much is dialysis? Like in Jude, I think last year it was 150,000. It depends on the condition, right? And we have some patients that will go for dialysis. How many? 3 times or 2 times in a week, depending on the condition of that patient. Some once in a week, some twice, some one can 3 times. Now, when you calculate, let's assume twice in a week. Calculate 120 in a week is how much? 240. Now, in a month is how much? 240 times 4. It's more than.
It's more than.
Times 5.
Times 5.
It's almost
times
600.
4, times 4.
Times 4.
Almost 600.
Almost getting to a million.
Yes.
Almost getting to a
Yes, more than
million.
that.
I remember when you entered the next month,
Some
you
is
still
like
continue.
300
Yes.
Right? So, is it not better to have this bottle? With
Depends
1.3?
on the condition.
It depends on the condition also for the care, for the dialysis. Yes. And what you spend from January to December as a family on health. One ba lafiya, wani zai je surgery. If I have this bottle, we will remain healthy at home. All those free radicals triggering all these conditions that we are seeing, contributing to these conditions, we are killing them, we are destroying them. So let me give them 4 questions, please. Sorry.
I wish they would make smaller